Find it. I've forgotten at home or something.
They're here somewhere. When we had to go down in these one section hard.
Yeah. Okay, now what is this number 5? I hereby consent to disposal or use of research purposes any tissues, parts, or products of conception which may be removed.
I can honestly tell you that does not happen. This is the general consent for the hospital.
Right.
This is real specific to transplant. This has to be in here to cover the hospital legally. Let's say they remove they get in there and there's some tissue and the doctors are concerned. They say, this looks kind of suspicious. They didn't plan on it, they remove it, they send it to the lab and they check it out.
Right.
They have to put this in here. I've never seen this happen in 14 years of transplant nursing.
Oh, okay.
But, I mean, I want to be honest, it has to be in there just to cover the hospital legally.
Well, the way that it's worded made it sound like
It's
research
kinda-
for going to a university.
I agree. I think
Okay.
the way a lot of people ask about that. I think the way it's worded is kind of makes you.
I don't want to 47 things. I've had that.
That's the steroids.
Yeah.
But the dose will go down.
Yeah.
Yeah. In about 3-4 months, it gets down pretty quick, Betty.
Okay.
I know everybody's concerned about that. Yeah, I would be too.
That's okay. At least we'll get to go shopping.
Yeah.
Anytime you want, not have to wait till you get off the machine, see if you're gonna be well.
That's right.
You can go shopping with the round face, it's okay.
That's right. I think she'll be surprised at a few months how good you'll feel.
So the donor situation, living donor situation, seems to be getting better. So that was really bad.
I think what happened was during the summer, the surgeons had vacation time in July and August. And then all of a sudden, we had these living-related patients and donors that couldn't get in the summer. We couldn't fit very many in the summer. So it's like, oh my goodness, all of a sudden October, and I think November, December will be very full. That's okay though. We like it.
Hope you won't get pimples.
I know. Get out the,
Candy Crease hair growth.
oh, I need my hair back. My hair fell out. I'm waiting for that.
Everybody has a couple things they like, a couple
Right.
that don't.
Lost all of my
Well, that may help you then.
hair.
That's cyclosporin. I know, it's Did you read that all through?
Oh, I did.
Okay,
Yeah,
okay.
because I was talking
Yeah.
about the
You're the first line to let that's
weakness of the muscles and so all that good stuff. Oh, what's aseptic
aseptic necrosis?
Yeah.
Okay. That is to do with the prednisone, and that can happen to your bones. I see this happen rarely. If it does happen, it seems pretty serious. I've seen people a couple times have a hip removed and have an artificial hip put in. I don't see it happen very often at all.
You know, the bones and weakness of the muscles, those are both on here. You know, I know about the bones and, unless I'm taking some like calcium or something.
Right. Yeah, and Dr. Cooper is, she's very pro watching women on dialysis with osteoporosis in their bones.
Yeah.
Because you've really got to, you really gotta watch for that. And she's very, very pro
That's
taking care of bones. Yeah, it is.
Hip and some people have, you know, all of it almost.
Yeah. Okay, now I want you to look this one over right here.
Okay.
I have went through all of that with you, but that is written down.
Okay, that keep this.
Yes, that is
Okay.
yours, but I just want you to look that over.
Uh-huh.
Like I said, I went through everything with you, and I want to remind you of a couple important things. Right, after midnight tonight,
So we
Nothing.
just have a big dinner tonight.
yeah. Now, if you or Paula, and I have to tell you this, if you or Paula accidentally have breakfast, surgery would be canceled, okay? And like I said, the medications for you, with a little sip of water, that's different. And you check that with the anesthesiologist,
Okay.
that's important. Because I think there's several medications they're gonna want you to take,
Okay.
yeah.
Sure. Added risk. Excuse me.
The Imuron?
Imuran,
Yeah, Imuron, what is that?
that is the one I talked about, that's one of the 3 anti-rejection medicines. And people tolerate it pretty well, it can decrease your white blood count.
Okay, that's the one, okay.
Yeah.
And then
Let me watch your
Cellcept?
white. Cellcept, that's mycophenolate, that's another name. You will take either Imuran or mycophenolate, not both.
Okay. I seen that
One
in
of the
other notes.
anti-rejection, yeah.
Okay.
There's a lot of names, it's hard to remember all of them. Okay, now let me just check it over, I just wanna make sure. Oh, I never mentioned the shower. When you go to the pharmacy, you're gonna get a bottle of Physa-Hex. You probably know what it is.
Oh, yeah.
Yeah, yeah,
I
Sandy.
haven't heard that in a long time.
Five,
It's used all the
you
time.
used to use it with your kids?
Oh, yeah.
See, yeah. Oh, we used to use it a lot, I guess, with
Mhm.
my mom used to use it on my knees. So you'll get a bottle of this tonight. And it's kind of expensive, but we just get one bottle, and then you and Paula split it.
Okay.
You just
all right.
need a little bit, you'll have leftover.
Uh-huh.
And mostly concentrate on your tummy. That's gonna where the incision's gonna go.
Uh-huh.
And it's just to take the germs off your body so you don't get infection in that
Right,
incision.
yeah.
Because infection is something, you know, we have to think about. So share that tonight, take that shower. If you wanna do it in the morning, that's fine. You can shampoo your hair or do everything normal with your hair. Don't forget in your hair. The anti-rejection medications I told you about, the medications, nothing to eat or drink after midnight. That is yours to keep, that's your reminder. Paula gets one too. We're gonna have her start today about noon,
Oh.
drinking a ton of fluids. We want her to have a nice, plump, hydrated kidney.
Oh, yeah, okay, I see.
There's a little bit of difference. You kind of watch your fluids a little bit.
Right, yes.
Okay, that's everything. The other doctors, you know, they're gonna go through some of this stuff with you probably. I'm probably the most thorough.
Mm-hmm.
Of course, the nurse.
Yeah.
Don't get that one. The nurse goes through all of this. Any other questions, anything else?
I just hope everything goes well. 'Cause, it will.
I think it will. Okay, you doing okay?
Uh-huh.
Okay. Okay.
Now, what's gonna be my role when they come home? They're coming to,
They're gonna be busy.
my
Don't
house.
kid you.
I know.
They get you.
Paula says, I'm gonna
Roller
ring a bell.
skates.
I said, you better not ring a bell.
I have 3 bells, so we have.
They're gonna work you, girl.
They're gonna drive me crazy.
Your role is, generally, people that have transplants and donate kidneys, they do not require, quote, nursing care. Unless there are complications and things that go on, we would help you with that and, you know, train you and do whatever we had to do. Generally, They can take care of themselves and bathe themselves and go to the bathroom and take care of all those personal things. Oh, yes. The things they're gonna need help with are cooking, meals, laundry, housework, those kind of chores. But they can walk, and they're gonna take it pretty easy the first week when they get home. But I think they're both gonna be amazed at how good they feel in about 2 weeks. 2 weeks, it's like, gee, they didn't even have surgery. And Paula probably will go out and do way too much stuff about the 3rd week. And then she's gonna exhaust herself. And it's like, oh my God, I'm exhausted. It's like, because she did too much. So I think people have to, about 2 weeks, you have to do energetic things. Maybe, going to the doctor office will be a big deal. Maybe run an errand and then go home and rest. Then have some activity later and then rest. So you want to alternate activity with rest, activity with rest. They're going to do fine. I think she's going to need help with her flow sheets. We'll tell you more about this in the hospital. But she's going to have little flow sheets to keep up. They're going to have to get your weight once a day and record it on your flow sheet. You're going to have to get your blood pressure twice a day, morning and night, record that on your flow sheet. And your temperature, morning and night, record that on your flow sheet.
And then just like do that.
Yeah, that's what you were telling me.
And
So she might need help with her flow sheets.
Okay.
And her medicines, it can be a bit overwhelming. But we'll do a lot of teaching in the hospital, and you can be supportive in that. You're going to need help probably, going back and forth to doctor appointments, especially you, the first month. Yeah, at least twice a week with blood draws each time. Gotta keep a close eye on you. We gotta, I know.
Also, would we possibly get a blood pressure, something,
You need a blood
I
pressure
can't
cuff?
read those things, yeah.
You bet, I'll get you one.
Okay.
Do you have a thermometer?
Yes, I
We
do.
do, yeah. And then I saw one in my supplies. It's a cover and it has a little line on it, so when I put it on, I guess it would come in onto the deal. When it'll show up, the numbers. Well, it was in my supplies. It's got a cover on it, and there's a little window. I think it's a thermometer, I'm not sure.
It's in your supplies.
Is it come with the battery?
I'm not sure, I didn't really
I'll
look
look
at
at
it.
it.
I didn't really look at it.
If you need a digital thermometer,
Yeah, I
I
think
have
it's-
them here,
Okay,
and I'll give you one.
okay.
Yeah.
And
Probably
when I
just-
see
it must be
then I
digital.
feel it. Yeah, I think so.
Yeah, it must be.
I'm not
Yeah.
sure. But I better
It's e-
take one anyway.
You want one?
Yeah.
You're funny. I'll have to take one anyway.
Yeah.
Do you guys have a scale?
Yes.
Yeah.
Okay.
Mm-hmm.
Well, yeah, you're mostly going to be supporting, running errands, cooking. Like I said, they're not going to need nursing care.
The scale is in, what do you call that, milligrams? The scale is not in like 165, it's in like 66.5 or something like
It's in
that.
kilograms?
Yeah,
Kilograms.
kilogram, yeah.
That, if it's pounds or kilograms, either way, just
It's
as long as
okay.
it's the same scale at home all the time, we want it consistent.
Right.
Okay,
Alrighty.
now, your next appointment is 10:30 with Dr. Hefty.
Okay.
Now, we can do one of two things. You can take a break, go get some coffee, see Dr. Hefty at 10:30, same floor. Or, if you want to go to the lab and get your blood drawn, I would like that.
Yes.
I
I
would
want to do
love
that
that.
too.
But like I said, if you don't want to,
Yeah.
you can do it later.
6th floor blood,
We'll do
5th
that.
floor x-rays.
I doubt that you're going to.
You missed this over here.
You didn't really want to, did you? Some of it sounds really good.
Hello, people. It is Holly. Oh.
Boy,
How are you doing? I was just I wait patient for my turn.
okay.
Hi, I'm Wanda Ryan.
Oh, hang on a second. Wait.
I'm
Stand
already-
back. You're gonna have to stand back a little bit. I get a focus on you. And you can just stand where you are. Stand still, Wanda. Oh, very good.
Tell me when.
Yeah, sure.
Okay.
Okay. Hi, I'm Wanda Ryan. I'm your transplant coordinator who's going to be working with you today. You ready to come on back?
Yes.
Come on, girl. Let's go.
Thank you.
And you're going to have a fully catheter that goes into your bladder, goes up to your urethra, and it drains out your urine. Okay? That's put in while you're asleep. The first night, you're going to be glad that you have it, because you don't have to get up and pee. It's going to be nice, okay? You'll have it in for probably 3-4 days, okay? Depending upon the thing that usually stops a donor from getting that catheter out is the medication you're going to be getting, which I'm going to tell you about, pain medication. Because some of the pain medications cause urinary retention. And what good would it make, what good would it do to take out your catheter and you can't pee and we have to put it back in? That would just be more stressful. So, in my opinion, and this is the opinion of the doctors, it's better to leave it in so we know you're not going to have urinary retention with your pain medicines. You want to make sure you can pee when you get the catheter out. Okay, the reason it's in is we got to let those incision sites that are inside you that you can't see heal. They got to heal. Okay? So you wake up and you're going to have at least 2 tubes. One other tube that you're probably going to have, I want to talk to you about pain control. And you know, I've told you that you are going to have post-operative pain. You are going to. Okay? There's 2 ways that they can keep you comfortable. There's what they call an epidural, and you'll probably have an epidural unless you're, you know, really opposed to it. You'll talk to the anesthesiologist about it tomorrow. Today. He's an expert on post-operative pain control. And you can ask the anesthesiologist a lot of questions if I don't answer enough. Most of our donor nephrectomies have an epidural. They're put in while you're asleep. It's a little tiny catheter that goes into your low back. And moms use them a lot with labor and delivery. They started using them the last, oh my goodness, many years for post-operative pain, and people do very, very well. The tube goes into your low back, into the spinal column, and it goes to the epidural sites where we feel pain in our spinal column. And this catheter goes in there, and it's taped. You'll feel the tape on your back. You'll be like, what's on my back? You'll feel this tape, and it'll go around over here, and it'll be taped on your shoulder, and it'll go over here to this little box. And this is a little tiny computer. And pain medication is delivered in that little small spinal column that goes to your spinal column.
Okay.
And what this pain medication does is they give you one medication called bupivacaine. It's like Novocaine. The doctor numbs you when you do mouth work. And this numbs you. And this is the great part. It numbs your incision. Wouldn't it be great if it was numb? And then they give you a synthetic morphine in there as well. And that helps you with pain control. And together, those work very, very, very well. Can't overdose, can't get too much. And then there's a little button. Let's say you need more pain medication. Well, some people do. You can hit the button and get more. If you don't need it, don't use it. If you need more, hit the button. Now, if you're hurting after surgery, it's your job to tell everybody. There's no awards. Good. There's no awards for taking the most pain. Okay, so you tell people. A lot of people will ask you, what's your pain level on a scale of 1 to 10? 10 is the most pain you've ever had in your life. 0 is none. So they'll ask you to rate your pain level. Okay, so I'd say 1, 2, or 8 or 9, you're screaming, you're having a lot of pain, help me. So that's the epidural. Most of our donor nephrectomies do very well with those. And I think that they will want to give you one. Let's say you don't, for whatever reasons. The other way, and this is what your mom will have, it's called a PCA, a Morphine Patient-Controlled Analgesia. It's a little box over here, set up on a little computer, and it hooks up into your IV, and you hit the button, and you get morphine or Demerol intravenously. The problem with that is the side effects of morphine makes you sleepy, and it can make you nauseated.
Mm-hmm.
The epidural, you're more awake, you can move and do all the things you gotta do to recover and get out of here.
Okay.
So, the anesthesiologist will talk to you more about those, but I really, I think they'll wanna give you an epidural.